All right.
Hi there, this is Debbie Nicholson, the Director of Community Outreach from BeatCancer. And today we have a really special podcast that is a little outside the box with two traditionally trained medical people, which is really interesting. So we have Dr. Bernie Siegel here, and he's a clinical professor at Yale for general and pediatric surgery. And he went from that position to being named, and I want to get this right, one of the top 20 spiritually influential living people on the planet, and a 2018 VIP Spiritual Leader top pick for his lifetime achievement. I mean, that's incredible for someone traditionally trained to make that type of leap. And I think he saw in his work what could be possible with the healing potential. And Carrie Hardy is one of our holistic cancer coaches. She's also a traditionally trained RN. She's a holistic RN, and she's also a Reiki master and a crystal and pranic healer. And they both have realized and want everyone to know that healing is possible in ways with love and raising our vibration. We're all energy, and if we want to heal from cancer, we have to connect to that mind, body, spirit part of us that's vital. And we have two wonderful people to help us with that message today. So I'm extremely excited because I think this is the missing link that a lot of people need to learn about. So welcome to both of you.
Thank you.
Thank you.
You're welcome. So I'm so interested, Bernie, in how you made the leap from traditional medicine to connecting with the healing potential within.
All right. It's because I cared about people. I became a doctor for a reason that most people don't become a doctor. Because when you asked, as I have done, medical students, draw yourself working as a doctor, 98% of the pictures, it blew me away. This was a few years ago. I was speaking at a medical school. They drew themselves sitting behind a desk with their diploma on the wall. Wow. Nobody put a patient in, except for one student.
Really?
He was kneeling in front of a lady in a wheelchair, handing her a tissue. See, he's really a doctor. You know what I mean? He's doing something for her. I mean, some of them just had instruments and computers in the picture, not even a human being. And well, and I think this reflects on the higher suicide rate amongst doctors than amongst the general population. And what struck me was the highest rate was in anesthesiologists. So think about that. Why do you become a doctor? Oh, so I can put people to sleep.
Right.
I mean, what is going on? I always remember my wife was about to have breast surgery for a small cancer, and the anesthesiologist knew me, so he wanted to impress me that he was going to take such wonderful care of my wife. And he walked in to see her, and she looked up at him and said, "My, you're quite a handsome fellow." From there, they were on a date. You know what I mean? He became a human being. My wife is just so good at that. She melted him. "You're such a handsome fellow." Oh, so after about 15 minutes, I said to both of them, "We're here for surgery, not to have a date," you know, because that was no longer a part of their day. You know what I mean? And I think this is what has to happen, that we have to humanize the process of caring for people.
What do you think the block has been?
The what?
What do you think the block has been?
Well, you don't get educated. You get informed.
I see.
You see, well, Carl Jung said it beautifully. He said the diagnosis helps the doctor, but it doesn't help the patient. For there, the key thing is the story. See? And when the doctor knows the story, then all their treatment can begin to operate and make a difference. But how many doctors ask, "What's your story? What's going on in your life?" Why I got into this is one of my patients meeting me at a conference. And this again blew my mind. It was Carl Simonton. He had written Getting Well Again. He came to Connecticut. I thought, this is great. I'll go to the workshop, have more tools and ways to help patients. I was the only doctor in a room of about 150 people. That blew my mind. Not one single oncologist came to a meeting, but all my patients were there. So they surrounded me, and the key words were, you're a nice guy. I feel better when I'm in the office with you, but I can't take you home with me, so I need to know how to live between office visits. And that's where the transformation happens. When somebody comes in and says, oh, I have only 2 months to live, then let's start living. And I could take this whole program with people who accepted the fact they were going to die. But then they said, let me do what I love to do the last few months of my life. Move to Colorado. Buy a house on the ocean and listen to your tapes. No, I'm not going for treatment. I'm a landscaper. I want to go make the world beautiful and die leaving a beautiful world. I got a dog and put in a backyard wildlife habitat. I mean, all these things that people did, okay? The letter from that last lady when she got a dog was, I didn't die, now I'm so busy I'm killing myself. Help, where do I go from here? My landscaper, 6 years after he said, it's springtime, I'm not going to have treatment, I'm going to make the world beautiful. The nurse handed me his chart, and I said, he's dead. You know, we must have 2 people with the same name, because he had never come back. She said, open the door. So I opened the door to the examining room, and there sat John. Hey, I got a hernia from lifting boulders in my landscape business. He died at 91, and he became my teacher. I mean that literally. I spent a lot of time with him. The guy who went to Colorado, I told the family, don't forget to call me for the funeral, because I felt very close to him. Because he said, it's beautiful there, I want to die in the mountains. A year later, I called them to say, why did you not call me? You know, why were you so insensitive? But he answered the phone. And he said, it was so beautiful here, I forgot to die, you see. And it's those kinds of things over and over. And I understood that if you help people live, their body got the message and it changed things. So I you know, again, I say to people, pay attention to your feelings. You know, it's let your heart make up your mind. Let's put it that way. And when you let your heart make up your mind, then a lot of wonderful things happen, as I say, including your body getting the message. I mean, one lady who, because I was just thinking of Alex Trebek, you know, I don't want people to fight a war, you see, because then you empower your enemy. None of these people said, I beat the shit out of that cancer. I get it, you know, I killed it. They all went home and healed themselves in their lives. And then something nice happens in their body. So it's a very different situation, because one of the patients I had who had pancreatic cancer, she had such a big tumor, you could feel it in her belly. And she said, okay, enough. I'm just going to go home and, you know, enjoy my last few months. And she went home, and a few months later, I heard my partner say to me, Bernie, come in here. So I walked in, and there she was on the examining table. And he said, her tumor is gone. I can't feel a damn thing in her belly. You know, your stuff that you're always doing, you know, talking about. So I said to her, tell them what you did. She said, you know. I said, I know, but you tell them. These are her exact words. I left my troubles to God. Wouldn't that be a nice way for everybody to be cured? But again, it's what happens when you do that. Think of how peaceful you'd feel if every morning you got up and said, God, today it's all in your hands. You know, I'm not going to get upset. I'm not going to worry. What a difference it makes. And so that's why I started cancer support groups. Well, let me add one more thing, then if you have a question, because everybody had a story, you see, so you can learn from them what the story is and then tell others, this is what can help you. I wrote an article on my work, the use of dreams, drawings to really understand people. In other words, you draw somebody getting chemotherapy, and literally this woman draw the devil giving her poison, she's in trouble, okay? And somebody else draws it as a gift from God, I wouldn't worry about her going to get it. But now I wonder where I was going. But, oh yeah, I sent the article to the medical journal, came back saying interesting, but not appropriate for this medical journal. So I sent it to a psychiatric journal, came back again. But this time it said, yes, it's appropriate, but we know all this. That's the sad part. That
So there's that
you go to a doctor, somebody says, oh, you have a head, a psychiatric, you go see this guy. You got something in your body, you go see this guy. You're treated like an automobile, which part isn't working, and we send you to the person to fix that part. But people are not mechanical objects. They're integrated human beings. And we know that your mind, your attitude affects your body chemistry. When doing this with actors, give them a tragedy to perform. Draw their blood. Immune function goes up, stress hormone levels go down. Give them a new script, which is a tragedy and a murder in it. I mean, I don't make up any of these stories. These are college students doing these things. And their immune function goes down and stress hormone levels go up. So you watch Broadway every winter, and you can tell who's in a tragedy because they drop out often for a week or two with the flu or a bad cold. But I always say, when you're working for Mel Brooks, you don't drop out. You keep coming back because it's so much fun and you feel so good doing the kind of scripts that he hands you, and it makes a difference. And people have to understand that. In one study of cancer patients, they were told, laugh for no reason every 3 hours. And then there was a control group that wasn't told to do anything. Guess who had a longer survival rate? The people who laughed. And yet we have to change the belief system, see, so that the oncologists understand this is a part of it, not just psychiatrists who come up with literally immune-competent personality articles, because when the AIDS epidemic, as an example, broke out, a lot of people went to psychiatrists. They were depressed. Look what's going to happen to me. And the psychiatrists saw that their personality characteristics predicted how they were going to do. If they were depressed, no relationships, they could be quick to die, while those who had meaning in their life, asked for help, helped others, laughed, I mean, that all these things, that personality, that they were going to do well. So as I say, you learn the stories and then you pass them on to the other patients so they know how to behave. You're a coach. Let's put it that way. If you join the team, I try to help make you a better performer. So if you walk in with a disease, I say, okay, this is what the people I know who have done very well have done. Let me tell it to you. And, give you a list, and you go home and live this and, make it a part of your life. And I call it becoming a love warrior and bringing love into your life.
So a lot of these things you're talking about, laughter and love, raise vibration.
Yeah.
And I know, Kerry, you talk a lot about raising vibration, and you have practical ways of doing that and ways that you have seen that work. Do you want to talk about some of those things?
The thing again that impresses me is if I try something and it works, then I don't argue over that's not a well-controlled study. Where's the science? It worked. I don't have to explain what's going on in my body. So I know with many people who are healers, and in the broadest term, doing many things, I would hear it and I'd say, oh, that's nuts. But I would try it. So, whether it's Reiki or, other things of visualizing, putting their hands on you. I can't remember. Yeah, I remember. I had it popped back into my head, a leg injury from training for a marathon. And Olga Worrell, the healer, was speaking to a medical group. And my wife said to me, go ask her to work on your leg. And I said, honey, that's nuts. You know what she's talking about. She's going to put her hands on me and I'm going to get better. So my wonderful wife went over to Olga and said, Olga, will you come over here and help my husband? I sat down in a chair. Olga put her hands on my leg. I mean, I couldn't believe the heat. It was like two hot irons. You know, I quickly put my hands on my other leg. I couldn't feel them at all. And here she is burning through my dungarees, you know, with that heat in her hands. And of course, 5 minutes later, I stood up and I was perfectly well. And we became friends, believe me, because then I learned from Olga, even her intuitive sense. I have an angel, I call him, named George. I met him in a meditation. And, you know, to me, it was just something I saw in a meditation. Olga and I were at a funeral for a friend. I spoke at the funeral, the Christian funeral. When we were standing together after the funeral, Olga said, are you Jewish? I said, why do you ask? Because I spoke at a Christian funeral? No, there's a rabbi standing next to you. And that was my angel, George. She described every detail, you know, what he's wearing, his beard. And I can't deny what she said. And it also happened when I was lecturing one night and realized I wasn't giving the talk. I mean, I was giving it, but somebody was telling me, you know what I mean? I always say I was the television set displaying it. And again, somebody came out of the audience and said, there was a man standing in front of you for the whole lecture, so I drew his picture for you. And it was George. And I knew it wasn't me. So I stopped looking at my notes. I just stood there and talked for a couple of hours. And, you know, those mystical things. See, when people aren't afraid to talk to you, then you hear these things. One of my patients was a mystic. She came in one day and said, I've learned you're not a normal doctor. So I asked the group, we had a group meeting with other mystics, to bring you a message. And then she said, from Frank, and she said this message. And I knew who Frank was. He was a doctor friend who had just died. I called Frank's wife. I said, I have a message from Frank, but I don't want to upset you. If you want to hear it, So I said it out loud to her over the phone, and she screamed. And I said, that's what I mean. I didn't want to upset you. You're not upsetting me. That's what he used to say every day when he left your meeting. The exact quote. And that's the part that patients would come in and not be afraid to talk to me because they knew, you know, I wasn't normal. That I had an open mind. And so they felt safe and could talk. And let me just tell you one personal thing, because my wife died about 14 months ago. And this mystic, my friend Monica, I thought, because she's always bringing me message, okay? I thought, all right, let's see if this is real. Because Monica doesn't live near us, doesn't know, you know, what's going on in my house. Well, on Sunday morning, the phone rang. And she said, Bernie, I got a call from a lovely lady who was an opera singer about your wife, Bobby. Everything's fine. She's back together with the family and everything's working out okay. Now, what was my wife's mother? An opera singer. See?
Wow.
Now,
That is just unbelievable.
You know, when I get a message like that, not to mention all the mystical things that have happened and still keep happening, because my wife doesn't let me go. So things are happening, you know, in the house.
Those pennies from heaven.
Yeah. And the grandchildren and great-grandchildren, when my mother died, that term started in our family. Because I found dozens of pennies. And it's always where they weren't, you know, a minute ago. Like I go with my mother, I'd go to the mailbox and find pennies on the way back up our driveway. And they weren't there on the way down. And one of the grandchildren said, oh, they're pennies from heaven. And boy, that blew my mind too, popping out of this little kid. But my wife has done some fascinating things because we were married on the 11th. And 5 times shortly after she died, I found a dime and a penny. Okay, the most mystical was I have a bird bath I built outside using an old satellite dish. So I heard the voice say to me, "Go clean the dish." So I go over, it's full of leaves and water. I pour them out, clean it. What was sitting in the bottom? A dime and a penny. Now, if you can find a reason why a dime and a penny would be, in a bird bath, let me know. But those are the things, and our kids are all believers now too, because of the things that have happened. And, that the spirit is there, the presence is there. Even feeling.
If we're open to it, if
Pardon?
we're open to this, then we start to see the signs and get the messages.
Yeah, the key that I realized more from my animal intuitive friend. You see, again, am I a believer? You meet somebody who says, I'm an animal intuitive. What do you mean? I talk to animals. My thought was, maybe you're a little insane, okay? I mean, what do you mean you talk to animals? But how do I get proof? Just like my leg was healed, our pets disappeared, some of them. And I called Amelia, sent her an email, and said, okay, where is it? Let me challenge her. And she sent me an email back describing the whole house, the area, every single freaking detail, and said the cat is under the house. Now, that seemed, what kind of stupid statement is that? But the next morning when I went out and called the cat's name repeatedly, I heard a cry. And where was the cat? Under a stairway that goes up to the house. And she had done that to protect herself because it was an indoor cat. So she squeezed in and put herself in a cage because we live in the woods that no other animal could, then get to her. And I got her out and brought her back in the house. But this has happened while, by the way, Amelia is in California and Africa and told me where to find lost pets in Connecticut. So you can't deny what she has done. And what she would always say to me, and why I bring up as an important theme, your cat disappears. What do? You start screaming their name. And Amelia would always say, Bernie, calm down, quiet your mind, get in your animal's mind. And that's what I learned to do. I even told some neighbors, they said, we hear you talk to animals and all, they think that's a little nuts. I said, quiet your mind, because their dog was missing for 3 days. Quiet your mind, talk to your dog, tell it you're worried about it, what's going to happen. They said 20 minutes after we did that, the dog showed up at their door. They had been gone for 3 days. And what I realized was, how does the ugly duckling learn he's a swan? You remember that story? How does he know he's a swan? Where does he see it?
His reflection.
Yes. Joseph Campbell talked about a tiger giving birth and dying. The goat she was chasing, this is what I love about animals. They don't kill her kid and say, we'll get even with that woman. They raise the tiger, and he thinks he's a goat. And then another tiger shows up one day and says, hey, stupid, what are you doing here? And he goes, eh. And he says, you're not a goat, you're a tiger. Come with me. Where does he take him? To Still Pond.
No, I think we froze.
She told me I disappointed her, I was a failure, and I embarrassed her, and she dressed me in dark clothes so nobody would notice me. Now, what changed her life? Yeah, she needed to get cancer and meet me and say, you gave me permission to become my authentic self. But if I hadn't quieted her mind, she never would have responded, recovered, or, started a new life.
To connect to ourselves, find our authentic self, experience joy, raise the vibration, and start living in joy.
Yeah, you have to, one lady with AIDS put on her refrigerator, when you live in your heart, magic happens. So I always say to people, let your heart make up your mind. See, I grew up with that. That's why I say we all need a manual. My mother drove me nuts. Ma, I got a real problem. Oh, God is redirecting you. Something good will come of this. Come on, I need help. Yes, God, she used to drive me nuts. And the other was, if I came home, what was the, I need help, Mom. I need to make a decision. She'd say, do what makes you happy. But when you're a kid, you don't live that way. It's what will people think? What's the best thing for me to do? But she would always force me to let your heart make up your mind. What feels like the right thing for you?
So she primed you. What a wonderful gift.
Yeah. And I think it's because they grew up, my folks, with all kinds of troubles themselves. So they had learned. And I learned most of the prominent clergy. My friend Norman Vincent Peale years ago, he said, his mother said, Norman, if God slams one door, further down the corridor, another will be open. You see, you don't turn out to be Norman Vincent Peale if you don't have that mother, and what she's opening up for you. So again, over and over again, the people who do well in the sense of life and contribute to it, they've been coached. They've had life coaches who have also learned from their troubles. Yeah, his father died leaving 6 kids and a wife of tuberculosis when he was 12. And they had no insurance. And one day I heard him being interviewed, and he said, one of the best things that ever happened to me was my father dying when I was 12 years old. So when I was alone with him, I said, what the hell are you talking about? When I heard all the horrible stories about what happened to your family, he said, yeah, but it taught me what was important about life. And boy, he was that kind of man, caring for others, a wonderful teacher. But he also taught me a very important thing. He said, if you want to say no, it's okay. See, that's part of the immune competent personality. Nurses have a big problem with this.
I love when you say this. When I met you, this is our conversation when I met you.
Yeah. I always ask this of every nurse, because you're asked to do a favor by a friend or family member that you do not want to do. What do you tell them? And 95% of nurses say, I would do it. Well, then what are you doing to yourself if you're doing what you don't want to do? And the survival answer is, I'd say no. And on the other hand, it's also okay for you to ask your friends and family for favors. So it's not you not bothering anybody. They have a right to say no, and so do you. And that's the important part we need to realize. And I've learned to do that. I always remember my sister calling me to come to some party at her house, and she lived a few hours away. And I said no. And I just didn't have the energy to go driving 4 hours one day. And she said, we're having a happy day and you're not coming. But if I was coming, it wouldn't be a happy day for me, spending 4 hours on the highway. And if the traffic was bad going through New York, it could be 5 or 6 hours. Yeah. So I said no. And then I feel better, and go home and relax. And I think people need to understand that it's okay to say no. It's okay to ask for favors, to have some meaning in your life. Monday morning, we have more heart attacks, strokes, suicides, and illnesses. It ain't Monday. It's the people and how they feel. Because, again, that's one of the first things in the immune competent personality. So I have a sense of meaning in my daily activities and work. You see? So if getting up on Monday is your way of contributing to the world and people, hey, it's not a threat. But if it's, oh, damn it, it's Monday, I have to go to work, I have to this, yeah. So you're better off getting sick, then you don't have to go.
Right. So Carrie, why don't you tell us about some of the healing modalities that help raise vibration, or some practical things people can take advantage of that will help raise vibration, connect to mind, body, spirit, and heal those parts of us. Talk about some things you do.
Well, we're all energy, vibration, energies everywhere. And some of these topics are crazy. And as when I first met Bernie and he called himself a crazy doctor, I said, we're going to get along just fine because I'm a crazy nurse. And we laughed and we talked about some of those things that are not talked about in traditional medical world. And crystals, essential oils, plant medicine, getting back to nature, realigning with the cycles of nature. And what we're putting into our body, whether it's raising or lowering our vibration, is so important. And when it all comes back to that self-love, I could talk about oils and crystals all day, but that's not what we're here for. I really wanted Bernie to get his message across about love heals. Love is vibrational, positive thoughts and are healing, and removing that negative from your environment and your physical is important. You touched, Bernie, on that when we fight cancer, that's a negative. And I learned that from you early on in your books. And I saw that with my patients as a home care nurse.
Right.
Those who fought the cancer and made it a negative were not as successful as those who accepted it because it's a part of you. You're now diseased, your body is imbalanced, so the cancer takes over. And it's part of you. So you actually need to love the cancer and the message that you're getting so that you can heal from it. Why did you get the cancer?
Let me add a story, because one of our group members was a conscientious objector, his religion. He went to an oncologist because he had cancer. And again, the oncologist doesn't ask his story. See, he has a diagnosis.
Right.
So he said to him, Dave, I'm going to kill your cancer. And Dave said, I don't kill anything. And he walked out of the office. And when he drew pictures for me, he was always carrying, these guys out of here, if you know what I mean. He wasn't attacking the cancer. He was carrying them away. And he lived for over 10 years. I mean, he didn't go home and die, But what if the doctor had said to him, Dave, let me make you well. I have a medicine to treat you. What a difference it would have been. Yeah.
Yeah. And our thoughts are so powerful. And I even remember sitting in class one day, and I used to not like to drink water. It's just my thing. And I'd say, oh, I hate water. I can't drink it. We are water. We're 75, 80% water. So I go around saying, I hate water. I'm hating myself. So the thoughts.
Jesus said to Nicodemus, when Nicodemus said, how can I be born again? I'm a grown person. We are water and spirit. Now, when I read that the first time, it made no sense to me. Okay, Adam wasn't made out of water. So why didn't he say to him, we are earth and spirit? Mm-hmm. But what I've learned is water is the truest sign of the magic of creation.
It is.
You cool anything, and it becomes more dense and heavier. In other words, if you walk into your bathroom when the heater's on, where's the hot air? At the top, and it's colder by your feet. Mm-hmm. But what happens when you freeze water? Where does the ice cube go? Mm-hmm. To the top. It floats at the top of the glass. Mm-hmm. And where does ice form on a pond? It's heavy, it's dense, but it doesn't sink. It floats.
It rises.
And that, I realize it's related to creation. If everything froze from the bottom up, life would be destroyed. Mm-hmm. So who figured out to keep the ice on top?
And then back to spirit, the mind, the body, and the spirit. That connection needs to be whole and working for true healing.
Right.
So back to the cancer for our watchers here. We can talk about physical things all day long, detoxing and what to eat and what not to eat. But if you're not addressing the mental piece of the thoughts that gave you the cancer, or that spiritual piece because you're not connecting with your true self, then the healing process is slowed or it's non-existent. So that connection is important.
And it has to come from your heart. Again, one man came into my office. I said, draw yourself. You know, he drew the family where all their heads were at the bottom of the page. I said, what's going on? You're all like upside down. He said, yeah, I'm on a special diet for my cancer, but I don't like it. The kids don't eat with us anymore, and my wife doesn't want to prepare it. I said, look, if you want to have an operation or chemotherapy, fine, go ahead. And, you know, he lit up like, oh, I can. I said, yeah. You know, it's not about others imposing things on you. It's about doing what's right for you. And that's something I've seen too, because what the patients who began to be called Siegel's crazy patient, literally, they had, because I had two calls that really struck me. One was from a radiation therapist who didn't realize there was no radioactive material in the machine when it was repaired. They didn't put it back in. So a month later, he checked it, which is a routine, and he found out that he hadn't treated anybody for a month. And I said to him, because he was very upset, I said, why do you think you couldn't tell you weren't treating people? I said, it's because everybody acted as if they were being treated. They were having side effects and shrinking tumors. And he almost fainted. He said, oh my God, you're right. I said, yeah, it wasn't your fault. And the other was a call from a radiation therapist who said, I thought my machine was broken till I saw your name in the chart. Then I realized it's a crazy patient. I asked her, how come you don't have any side effects to the treatment? She said, oh, I get out of the way and let it go to my tumor. And believe me, the oncologists in town who were very upset with me for doing all this mind stuff, you know, and distracting the patients. But they learned, as one said to me, I've learned about you and your crazy patients. He said, I agree with this woman's doctor that she probably has a couple of months left to live, but I know you and your crazy patients, so I'll give her hope. Within 6 weeks, she was in complete remission. And he put in his note to me, chemotherapy wonderful, because he knew damn well why she got well had more to do with me and her beliefs, because a relative said, oh, go see Dr. Siegel, he makes people well all the time. So when I gave her a hug, she said, oh, I know I'll get better now. He hugged me. And she went into complete remission. And that's what changed the doctors in town, to realize there are, you know, that was an affectionate term, Siegel's crazy patients. But they realize there are people who do respond and give them hope. It makes a difference. And one doctor, he was giving a chemotherapy protocol that was called EPO, E-P-O-H. He realized, hey, turn it around, it spells hope. These were the 4 drugs, the first letter of each drug. So he started giving hope as the protocol. He had more patients respond than all the other oncologists who gave EPO. And I was criticized for giving false hope. I said, that's an oxymoron. You can't have false hope. So, yeah. But that's how doctors get stuck in statistics and all other crazy things. Yeah.
They need to listen to their patients. And right. You as a patient, you know, your body knows what you need if you tune into it. And it will, you read the messages and you'll know if chemo is the right choice for you. Right. And if it is, that's great.
They draw a negative picture. I can say, then don't do this or change your attitude. How do I change my attitude? You visualize yourself getting the treatment and doing beautifully.
And then we're going to fix the cause as to why you got the cancer in the first place.
Yeah, I used to talk to people while they were anesthetized, because people hear you in coma, asleep, under anesthesia. At the end, I would say, you wake up comfortable, thirsty, and hungry. My patients began to gain weight. And the nurse said, it's because you're telling them they're going to wake up hungry. So I really had to change that to you wake up hungry, but you're not going to finish everything on your plate. But it fascinated me, just that simple statement. You wake up comfortable, thirsty, and hungry.
Mm-hmm.
And, you know, it was like hypnotic. So they went home and were always hungry. Yeah.
Well, yeah, you tapped into the subconscious.
Right.
So it kind of surpasses programming.
Yeah.
Because we're not used to checking in with ourselves and checking in with how we feel and connecting to ourselves and giving us permission. So how can somebody go about starting to do that? Becoming mindful?
Definitely becoming mindful, meditating, doing those types of practices like yoga, but finding the one that works for you, that resonates with you. I'm truly believe in the power of Reiki and energy healing in all different ways. That Reiki can really get into the subconscious. It can heal the spirit. It can heal your mind, some of those mental patterns, and the physical as well, with chronic pain and some of those symptoms that you're getting.
Yeah, I would say don't let beliefs stop you. Explore.
Right.
So if you said Reiki, that sounds crazy. Go try it and see what happens. You know, and then your mind opens, because if you go home feeling better, then it's not, I don't understand why it should work or what's happening or what difference does it make? It helped you, go ahead and do it. And that's the part, as I say, that changed me. When people weren't afraid to tell me what they were doing, you know, when I'd say, hey, you're doing very well. What are you doing? Because I wanted to pass the word on to others. And then you'd hear the things they were doing that weren't a part of my training or my teaching. But if it's working, fine, let's do it.
And I was grateful for you to be open to Reiki, if you want to share that experience. And then we even did it distantly when I moved to Colorado. If there's anything you can share.
Well, I mean, I always say I use myself in this experiment. So whether I'm in the room with you, or when you help my wife too, or whether you're, halfway across the country, if I feel better, I know something is happening. And that's the part that I sense and feel, because you help me quiet myself down, if you know what I mean. Rather than my schedule, we have have a house full of pets, taking care of it. I mean, I always say I'm very happy when I have nothing scheduled, because then I don't have to get something done by a certain time. The day can just flow. And so again, when you're having that kind of day and then you stop and get a treatment, and you get up and the energy has come back, you're calmer, something good has happened. And so to me, it isn't about beliefs, it's about experimenting and trying. And yes, I have to say it's true that if somebody believes something, then, whether it works or not, I have no idea if that's related to the treatment of the person's beliefs. It's like, on my website, I have an article called Deceiving People into Health, because I realized the power of hypnosis. So I did a lot of children's surgery, and I lied to the kids all the time for their benefit. And a simple example was you take an alcohol sponge to clean the child's skin before you draw the blood. But I would always tell them, hey, these are brand new things. They clean your skin and they make it numb too. So you won't feel a needle. And 80% of the kids would say, oh boy, that was wonderful. Why don't the other doctors use it? If they felt anything, I'd say, oh, that was a bad sponge. And I'd throw it away. But it was amazing to me how vulnerable they were, because in a good way, because either I or their parents were lying to them for their benefit.
Well, I think children have a higher vibration, don't they?
Of course.
Right. Mm-hmm.
Yeah. Yep. I always say they're my teachers, in terms of, reacting to life. not thinking all the time, but reacting. And that's why I say I learned from the way I was talking to the kids that I was having an effect on them that I never even thought about. I mean, one that became a joke in the operating room. You're in the emergency room with a child and you're going up to the operating room, and I wanted them not to be frightened. So I would say, you will go to sleep when you go in the operating room. I'm thinking of anesthesia. We began to notice that the kids were falling asleep when we wheeled them in, literally, on the stretcher. They would fall asleep. And everybody in the operating room started laughing. I said, what are you laughing? Look at your kids. They're all sleeping. And I realized it's because I told them in the emergency room, you'll go to sleep when you go into the room. And they did. And I always remember one boy, and he makes me laugh when I think of him, because he had appendicitis. We wheel him in, falls asleep. But he turned over before he went to sleep. So I pick him up, turn him back to put him on the operating table, and he woke up and started screaming. I said, what are you screaming about? You told me I'd sleep. I sleep on my stomach. I had a bargain with him to get him to turn over so I could get his appendix. But, you know, he taught me how literally people interpreted what I was saying. So to be careful what you say. And again, we're not trained to talk to patients. So we can induce trouble also. And that's why I like the drawings, because if you're lying all alone in an operating room, I'd say, then don't go. No, I want to have to then change your image of it. So you go home and meditate, go to the hospital, see everybody taking care of you, going home, you know, feeling well and doing well. And the same thing with treatments, that if they draw this, you know, the devil giving me poison, then you don't do it or change your image. And we're capable of that, you know, with all the energy that you can bring to people and their images. And by the time they go for the treatment, they do beautifully because you've changed their whole concept of it.
Well, that's very inspirational, that we can have a role in healing ourselves, and then cancer can be a gift, because then we learn how to connect to ourselves, live authentically, and learn to bring ourselves joy, raise our vibration. I mean, laughter's vibration, color's vibration.
Yeah, let me say, you made me think of something else that is related to the vibrations. I would say to people, what are you experiencing? Okay, I have a severe headache. I'm going to be admitted to the hospital. I've had a migraine for a week. What does it feel like? Pressure. Lady with cancer. What does it feel like? Failure. Now, when people came up with negative words, I would always say, what in your life fits those words that needs to be eliminated? If they came up with wake-up call, blessing, new beginning, fine. I don't have to worry about you and your diagnosis. But the lady with pressure, after we did a meditation to relieve the pressure in her life, the nurse came over to me and said, it's a marriage, her headache's gone, she's going home. Doesn't need to be admitted to the hospital now. And the woman who said failure, I said, how does that fit your life? Well, my body failed. I said, that's not my question. Said, oh, my parents committed suicide when I was a child. I must have been a failure as a child. Now you're really healing people's lives. And I just found that was so effective to say to people, how do you describe what you're going through? And that the words are always about their life. But as I said, if somebody said a wake-up call, good. You know, a new beginning, terrific. Those are the things you want in your life. But when you hear all the negative words, you know, roadblock, and it was, what do we have to do to heal your life?
But then we can teach people to see it in a different manner.
Right.
And then they can start towards healing.
It's a labor pain. There's a lot of women in particular who have written, you know, treatments and other things are a labor pain. And one woman literally compared it. You know, you give birth to a child, all the discomfort and pain is justified. But she was then saying, if I give birth to myself, all the discomfort and pain is justified. So all her treatments and operations and things, yes, she saw them now in a different way. And a lot of people write poems that are filled with humor. You know, I mean, one woman wrote a poem with bilateral mastectomies can't be fun, they're not worth having. And it finishes with, it felt good to get that off my chest. But when somebody can sit down and write something like that, they're going to do well, because they're not curling up, dying somewhere, frightened about everything. And people need to grow up. Let's put it that way. I always say we're all going to die someday. That's not the problem.
And laughter's the best medicine.
That's right. And because when you leave your body, you don't take troubles with you. I mean, I had a near-death experience as a 4-year-old, but there was a book called, Heaven is for real. Yeah, Mind Sight, in which people born blind had a near-death experience. And they all could see when they left their bodies. And some of them were very upset, when they were brought back to life, if you know what I mean. Like you're resuscitated and come back, and now I can't see again. Because this one particular guy was in a very bad auto accident, and when he left his body, it was fall. And he looked at the beauty of the leaves and what was happening, and then they resuscitated him, and he couldn't see that again. And he was very upset. And I know that feeling when I was 4 years old, that it was a hell of a lot more interesting out of your body than it is in it. So literally, the first words out of my mouth when I didn't die were, "Who did that?" I had said, "This is great, wonderful. Sorry my parents will find me dead." But, I was mad at God for changing my schedule, not the one I preferred. But I'll tell you, one of the profound things I did realize, and I was choking on a toy just for people so they understand what was happening. I aspirated it, was that I knew I wasn't my body. Because when I would talk about it, I would always talk about the boy on the bed while I was out of my body. And one day I suddenly heard myself saying, "Why are you talking about the boy on the bed or the body on the bed? You never say it's you." And I realized, because it isn't me. Yeah. That we're all spirit, soul, whatever word you want to use. We're not the body. That's our tool.
Really interesting.
Yeah, your mind is your remote control. The body is your television screen. So tune into the right channels and demonstrate them.
I think this is a lot of new information for people. It's almost a new language.
No, it's an old language.
It's just not talked about enough.
Yeah, all you have to do is read the Bible.
Yeah.
Read Science of Mind by Ernest Holmes. Those things, everybody's saying the same damn thing. One of the lines I loved from Jesus was, "It is done unto you as you believe." I thought, why didn't people yell at him and say, "Stop blaming us"? Because when I started asking people, "What's going on in your life?" doctors would say to me, "Why are you blaming your patients?" Yeah. And the other is, I say, read fiction if you want to learn the truth. Because the people who write fiction or create poetry watch the world and then write about what they see. We may not see it, but they do. So one poem talking about cancer by W.H. Auden, Miss G. Childless women get it, and men when they retire. It's as if there had to be an outlet for their foiled creative fire. What do you think a doctor said to me when I recited that at a medical meeting? Just be cancer. Last kid leaves home, cancer comes back and she dies 20 years later. Where the hell was it for 20 years? You know, that something is happening. You know, whether it's the energy you talk about in the sense of Reiki, you know, but something is happening in that body. So there are lots of people, I would always say, you know, who had pets. One woman had 12 cats, and the kid said, you know, she's going to have cancer treatment. We got to get rid of the cats. The house stinks. We don't even visit her. I said, no. They looked at me like I'm insane. I said, you get rid of the cats, your mother's dead. Clean the house. Tell her nobody wants these cats. And for years, they would come into my office smiling at me. Thank you. They say, no, damn well, Mom can't die if she's taking care of the cats. And, you know, they got close to her. But those are the things that always impressed me. And I may add, I don't know how long we can keep going, but in his book, Cancer Ward by Solzhenitsyn, there is the essence of it. One of the men comes into the ward and says, hey, look, I found this book in the medical library. It says here there are cases of self-induced healing, not recovery through treatment, but actual healing. See, there's those self-induced healing fluttered out of the great open book like a rainbow-colored butterfly. And they all held up their foreheads and cheeks for its healing, you know, for its healing touch. When I read that, it was like, wow, he knows. Solzhenitsyn, I learned, had cancer. So he knew. What's the rainbow-colored butterfly? Just what we're trying to teach people. Your life in order. Every color has meaning. So the rainbow is everything in order. What's the butterfly? You got to break out of the cocoon and create your true and authentic life. So when you break out, create that harmony, yeah, self-induced. Now, doctors don't ever use that term. Oh, you had a spontaneous remission. Instead of calling it spontaneous, why don't you say, what the hell did you do? Mm-hmm. Why didn't you die when you were supposed to? And every patient I thought was dead. I mean, this may sound funny, but you're out giving a lecture, you look in the audience, and there's somebody there you thought had died. They didn't come back to the office. I'd ask them, you know, why didn't you come back? What am I going to go back for? Nobody's telling me anything good, you know. But they always had a story to tell you about changing your life. Mm-hmm. And one gentleman who was at hospice, I came to visit him, he said, hello, Journey. Not Bernie, but Journey. And I think that's the answer. You know, he was my therapist too. We're all on a journey, and pay attention to what feels right. He who seeks to save his life will lose it. What does that mean? Mm-hmm. Do whatever your parents want, you give up your life. Mm-hmm. We want you to be a lawyer. We don't want a violinist as a son. True story. So he becomes a lawyer. Told he has cancer. Not long to live. Gets a job in an orchestra playing the violin, and of course, he'll die. But you see, he who's willing to lose his life will save it. Lose the untrue self, and you'll get a gift. Your body will know how you feel, and will do everything it can to keep you going. If you need help, ask. Don't use the disease as a way of getting attention. That's a whole other thing that a lot of people do. I want you to cure them, because then they won't be able to, you know, act sick and get the family to take care of them.
Very interesting. So we need to connect with ourselves, listen to what we need, learn to be authentic.
Yes.
Back to joy.
And to keep it up every day, a routine. Now, I walk the dog every morning and meditate. And what interests me, I live on a circle, so we walk a half a mile around the circle. And what interests me is how long it takes me to start meditating. Some days I'm in a good place, and just walking down the driveway, I'm already talking to God and my wife and, you know, everybody, all my angels. And then there are other days where I have to walk halfway around because I'm not feeling good, you know, about things that are going on. And I realize that, and then I start focusing and changing that. So by the time I'm home, I'm not in that place anymore. I've told all my angels, And I pray for others too. It's not just about myself, but it's just lots of people I've met in my lifetime, people who have died. I just talk to all of them. And I don't tell everybody because then they lock me up in the psychiatric ward. But, you know, it's getting their help and being there with them.
Well, this has been a great conversation, and there are a lot of tools available, and a lot of ways you can start shifting the way you're currently living to start to come into joy and your authentic self. Bernie's website, Bernie Siegel, SIEGELMD.com. He has a lot of books.
Let me add this as a closing comment: rehearse and practice. You know what I mean? Look for coaches so that if you're not doing it right, they don't say, "Oh, you're doing it, you're screwing." That they give you a little poke. You know what I mean? Like a coach would do, tell you how to do it better, and then rehearse and practice until you get it right.
Right. And Carrie, you're a coach, so maybe you can. You can tell us, you have a holisticheavenwellness.com.
I do. I have a website. I do coach as a home care nurse who's also dealt with transition and hospice. Cancer has been my focus. But it's important to find methods that resonate with you. As a coach, I really try to get into the person's mind and find out, well, again, where are you coming from and what do you need? Because you are different from the next person. And it's just about connecting with yourself, and we try to find those methods that do that. And of course, talking about diet and detoxing and energy work is all important. But if it's something that doesn't resonate with you, then we move to the next thing and we figure it out. So it's really a personal decision when you find a coach who can help you and keep poking you along in a positive way.
Yeah, it's not criticism, it's coaching. And to pay attention, I don't know why it popped into my head. I asked a group of people one day, if you had 15 minutes to live, what would you do? And, you know, my comment is, I don't want to be on the telephone the last 15 minutes of my life telling everybody else how I love you. And then one of our kids happened to be in the audience, and he just piped out, I'd buy a quart of chocolate ice cream and eat it. And since then, that's always my answer. You know, if you said, what should I do? What's your chocolate ice cream? You know, go live your chocolate ice cream. And what a wonderful life you can then have. And all the things
you're worth it. And you're worth it.
Yeah.
You have to believe you're worth it and you deserve it.
See, every time you say something to me, I got another story to tell you. That I often say to people, when you get to heaven, how are you going to introduce yourself to God? Because there's an admission line there. So when you get to the head of the line, they say, you're next, how do you want to be introduced? If you say, I'm a doctor, come back when you know who you are. And I was thinking, if you had to introduce your right arm to your body, how would you introduce it? And the answer is, they don't need an introduction. They made it the same thing come to, you know, the same thing. So when I get to heaven, they say, how do you want to be introduced to God? I say, tell him his right arm is here. They say, come right in. That you're God, you know? And I have a little book, 365 Prescriptions for the Soul. Because I
love that book.
Every day, every day. And I keep relearning, even though I put it together, I can't remember everything that's in there. So when I'm reading it, it's like, wow, did I say that? That's good. I have to go to a chiropractor today. You know, there are no coincidences. See, you live that kind of life. And I mean that. That started with Elizabeth Kubler-Ross. Again, the Jungians. There's no coincidences. And I have to see a chiropractor today. And the topic was upright. How come we, you know, stand up straight and animals are horizontal? But at the end, my solution for the day become upright in your life, relationships, and work. If you need help, find a spiritual chiropractor. So I have an appointment today with a chiropractor. I'm going to bring this to him, you know, so he can see how I feel. But it's, again, getting us healed. And
there are no coincidences, as you said, and the messages are all around. And I want to share a story with you, Bernie, briefly. Before I moved, I remember being in your library, and I took a whole box of books from your shelves.
Right.
And I really literally just unpacked them 2 months ago. And I got myself worked up about something, and all of a sudden, my angel, like your George, all of a sudden a book fell off the shelf. And I picked it back up. It fell off 2 more times. And I'm like, all right, I'm going to read it. And it was that book, Conversations with God, that you had given me. And I opened to a page that was totally appropriate for what I needed to hear at that moment. And I'm like, all right, Bernie, thanks. But it just hit me now that last night this same thing happened. And actually the book's right here. I was having a conversation with a family member, somebody very special to me, and I just couldn't get it right. And all of a sudden this book falls off the shelf and I open it and it's amazing, okay? But I'm just looking now, the power of unconditional love.
Right.
And this is what we're talking about today.
Right.
So there are no coincidences, and the messages are everywhere. We have to be open to them.
Let me conclude with this. I promise I'll be quiet after. That Thich Nhat Hanh, bells of mindfulness, he talked about. See, you build things into your day to help you. Like I talked about meditating, praying. And he said in a Buddhist country, you hear temple bells, you stop and you breathe peace and meditate. Here, he said, you come to the United States, you don't hear a temple. You hear horns, noises, you know, explosions. He said, so you've got to create some kind of temple bell. And I thought, hey, a telephone's a wonderful thing. You know, we get all these phone calls that you get annoyed about. But instead of getting annoyed, sit and listen to the ringing 6 times. Then I pick it up and I'm feeling peace. And I don't mind somebody trying to sell me something, you know, because I'm sitting here in peace, thanking them for calling. Well, I call my mother in her 80s, you know, various disabilities and so forth. I could never get her to come and live with us. She loved her house. So I call and the bell is ringing, the phone is ringing, the phone is ringing. And I think, geez, I got to hang it up and call her neighbor to say, go over there and see if my mother's okay. Finally, before I hung up, I hear her voice. Hello. I said, Ma, are you okay? Why are you asking? You didn't answer the phone. I know, I'm breathing peace like you tell people. I said, no, that's not for you. You answer the phone. But that was so funny. I was really in a panic. But that was my mother. And 5 or 6 doctors called when she finally died and told me she was amazing. And I mean, for a doctor to call you when the patient dies, they had to be very special. And she was so special. One day when she said to me, I got to go get a blood count. I said, for what? Don't you remember I have leukemia? No. I said, I don't remember. But that, you know what I mean? She was such a perfect example. She lived every message I ever put out. So I forget my mother has cancer. Yeah, because she was doing so well, not complaining, everything, you know, living my sermon. What an example she was. And the doctors were impressed by what she did and what she taught them.
Amazing.
Yeah.
Okay, well, all I can think of is chocolate ice cream. So everyone, tune in to your chocolate ice cream and what brings you the most joy. Tap into your inner child and take the time to listen to yourself.
Right.
Because we all deserve that, and we deserve to have joy and live an authentic life. And this is our only life. So make it important and make it special. And remember that cancer is not your enemy. It's interesting that traditional medicine has the war on cancer, And
it's not.
not to think of it that way. Think of it as part of
There are what I call spiritual flat tires. And why the no coincidences. When you're on the way to the airport and you get a flat, don't get upset.
Mm-hmm.
When you get to the airport and you learn the plane crashed, think of what's been happening recently with all the plane crashes.
Right.
If you missed one of those flights, you know, standing in the airport, oh, God damn it. But then when you hear the news, it's, oh, thank God I had a flat tire.
Mm-hmm.
Right. The universe has your back.
Right.
That's right.
Wonderful.
Okay.
Well, it's been a joy
Thank
speaking the truth with both of you, and learning another way to tap into ourselves and heal.
Mm-hmm.
It's been really delightful. And don't forget to go to Carrie's website, holisticheavenwellness.com, and also BernieSiegelMD.com for an incredible amount of resources and interesting topics and things that will help redirect your healing journey, because it is a journey, and we're all here to support you. Thank you so much, both of you.
Bless you.
Thank you.
That's you.
Love.